It's time for Your Turn with Dr. Elizabeth Vaughan. Good morning.
Good morning again.
We have Diane on the line from Burlington with a question. Good morning, Diane.
Good morning.
Good morning.
I was wondering if you could recommend something for GERD.
For GERD, for that you're talking about gastroesophageal reflux disease.
Yes.
All the routine things that conventional doctors suggest in terms of not eating late at night, not going to bed for 3 hours after you do eat, avoiding fatty meals, especially in the evening, caffeine, chocolate, alcohol, nicotine can all contribute to GERD. There's nothing wrong with using the over-the-counter Prilosec or Zantac or Tagamet on an occasional basis, but you really want to figure out why you have it in the first place. My orientation is sometimes that you actually need some more stomach acid as opposed to less stomach acid, because stomach acid tightens that muscle at the bottom of your swallowing tube so that you don't have as much reflux. But start with those conventional things, and if that doesn't work, see an alternative doctor.
Becky in Greensboro is on the line with a question. Good morning, Becky.
Good morning.
Good morning.
Thanks for taking my call. I want to know which protein supplement you would recommend for a woman in her mid-60s who's diabetic, soy protein or whey protein. I'm not a big meat eater.
What's your blood type?
Type O.
Type O. I would go with neither of those. I would go with hemp, which is an excellent source of protein. You could also use the fermented soy, which is tolerated pretty well by type O people, and rice-based protein. You could also use an egg white protein. You want to get enough protein in, especially as you get older, because you tend to lose muscle, and if you don't have good quality protein and absorb it, you will get older faster. So try to get at least 20 grams of protein in for breakfast and lunch, then maybe have a little bit more carbohydrate-heavy meal at night.
We have Johnny on the line from Seagrove. Good morning, Johnny. What's your question?
Okay.
Good morning.
Why does diabetics crave salt, and why is it so hard for a diabetic to lose fat?
Oh, that's a complicated question. Many diabetics crave salt because they are low on some of their adrenal hormones, and they that will force you to want more salt. So I would talk to your doctor and monitor about checking your adrenal hormones out and monitoring your blood pressure. Frequently you're on a diuretic, which is going to wash salt out of you, so you're going to want more of it. You've got to hit a good balance there. It's hard to lose weight because you have insulin resistance, and that's a huge topic. One of the important things is to make certain that you have enough of the healthy fats in your diet, like cod liver oil, evening primrose oil, and that you are digesting those. Many diabetics are on Prilosec or Nexium, and they don't digest their fats well. And if you don't get the right kind of fats into your system, you are not going to lose weight, period, end of story.
Let's go to Kathy in Denton. Good morning, Kathy.
Good morning.
Good morning.
My friend's daughter just turned, she's about 16, and she's developed a fuzz on her upper lip, kind of like a mustache.
Mm-hmm.
Would you have any idea what might be causing that?
Well, she has too much androgens, too much male hormone relative to how much estrogen she has. Sometimes birth control pills will do this. Other times, the same way I mentioned earlier, where boys' hormones can get confused and they can get breasts when they're going through puberty, girls' hormones can also get confused and they can produce a little bit more androgen compared to the estrogen. There are ways of fixing this. There's actually a cream that she can use temporarily to get rid of it, but I would have her checked out by her doctor to make certain that she's not having other bodily symptoms of too much androgens, because it could be an adrenal tumor or an ovarian tumor. So get her checked out by a conventional doctor before doing anything else.
Let's go to John in Robbins. Good morning, John.
Good morning.
Good morning.
How are you?
I'm fine, thank you. What's your question?
My question is, I have a digestive problem. It's caused me to sweat profusely. I tried the enemas and the magnesium citrate. Whenever I stop sweating, my eyes get to be a blood red, and my breathing becomes very labored. Do you have any idea what this could be?
I have no idea from that combination of symptoms. There's something called dumping syndrome, where the food in your stomach rushes into the intestine sometimes, and that can cause profuse sweating. I don't know about the eye injection. It can also cause hypertension, and there are different ways that you treat it, but I would definitely see start off with a conventional doctor to get that further evaluated, because it doesn't sound like a good combination to me.
All right. Thank you so much for coming in this morning.
Great, good questions. Sorry I can't answer all of them. Y'all take care.